This animation is designed to give jurors a basic knowledge of spinal anatomy and a clear understanding of the mechanism involved in spinal radiculopathy. It is intended to be narrated by your expert witness as part of a video deposition or live at trial. A sample narration is included here. While this animation is available as a customer service at no charge to Verbatim clients, this copy is for review purposes only. To understand spinal radiculopathy, let us first review the anatomy of the spine. The spine has 24 individual bones called vertebrae. There are 7 cervical vertebrae, C1 to C7, 12 thoracic vertebrae, T1 to T12, and 5 lumbar vertebrae, L1 to L5. The vertebral bones are separated by intervertebral discs. Discs are comprised of a tough fibrous outer layer called the annulus and a soft, gel-like center called the nucleus. Discs act as a shock-absorbing system protecting the spine from the forces and stresses of everyday life, and while each disc flexes only a small amount, together they allow for considerable flexibility. Each vertebra has an opening called the vertebral foramen. Together, these openings form a channel which holds the spinal cord. Spinal nerve roots branch out through openings formed by adjacent vertebrae. These openings are called neuroforamina. In addition to providing structural support, the spine surrounds and protects the spinal cord. The spinal cord is comprised of millions of nerve fibers and is the main pathway for information connecting the brain and peripheral nervous system. Motor nerves carry information from the brain and spine to activate muscles and glands. Sensory nerves carry information such as feeling, temperature, and pain to the central nervous system. When the spine is subjected to trauma, it can cause the outer covering of a disc to weaken. This can result in the disc bulging, and may also result in a disc herniation, allowing the inner content of the disc to protrude out. When this results in the compression of a nerve root, it can cause radiating pain, numbness, tingling, weakness, and loss of motor function. These conditions can also interfere with the normal transmission of electrical impulses to and from the brain. Depending upon the severity of the condition, symptoms of spinal radiculopathy can range from mild to debilitating. We can easily customize this animation by illustrating conditions at a specific level. We can illustrate a bulge rather than a herniation, and we can include information and/or images from diagnostic studies.